year. The national average numbers of the prefectures, which we have just around maybe 47 prefectures, just below the 50 prefectures. The average was 600 cases. The Kagoshima prefecture had 1,500, was the third place. So when we look only for the perinatal and maternal emergency transportations, which was counted in 2020, Kagoshima Neonatal Center had just below the 25 cases for that uh, year, which was the pandemic year in Japan. For the about the fetal screening in remote island communities where there are no obstetricians, OBGY doctors, pregnant women were sent to distant locations such as Amami Oshima Island or Kagoshima cities and moved to the area around the delivery facilities 2 months in advance. If any abnormality is noted, they're referred for the fetal screening at secondary and tertiary medical institutions, such as Kagoshima universities. From April 2015 to March 2021, 433 cases of the congenital heart disease were admitted to the Kagoshima University, and 377 cases were diagnosed in the fetal period, which means that 87% were diagnosed in the fetal period. All fetal diagnosis cases were born at the university hospitals. Out of the 433 patients, fetal diagnosis of severe congenital heart disease other than VSD, ASD, and PDA were 121 cases, and postnatal diagnosis was 28 cases. So consequently, the fetal diagnosis ratio of severe heart disease was 81%. Please remember of the number of the 80%. The lowest prenatal diagnosis rates among the congenital heart disease were TAPVD, corrected TGA, DILV or DLIV, detransposition rate alters, and PAIBS. So when we turn to the northern part of the Kyushu, here there's the Kagoshima University, and here's the Fukuoka Children's Hospital, which covers the whole Kyushu area. Blue spot is for the secondary medical institution, and the red spots means for the tertiary medical institution where the open heart surgery will be performed. But still, when the very severe open heart surgery, such as the Norwood procedure or maybe Nikaido procedure for the truncus atriosus, will just transfer to the Fukuoka Children's Hospital. So almost all the area will be, if there are severe cases will be happen, they were asked to transfer to the Fukuoka Children's Hospitals as something safer, something like this. So among the 2 years of the 2015 to 2016, there were 280 cases who were admitted to the NICU. The most majority was the TGA for 44, 55 cases, and HLHS was contained for 36 cases. The others as follows. The number of hospitalization for CHD was 120 cases, and in-hospital deliveries was 67 cases, and neonatal transports was 52 cases. The fetal diagnosis, 76 cases of severe heart disease, was 65% was just under control. So this is a very important, I think, slides because among the 2017 to 2018, The cases who were required the surgical treatment among the neonatal period was just 67 cases. Among the 60 cases, the emergency neonatal transports were required for 11 cases. 7 cases was coactations, and 1 cases were TAPVD, and 2 cases were the HLHS, and 1 cases was the detransposition of great arteries. The other 80 circumstances were among the 56 cases were just only for prenatal management at the Fukuoka Children's hospitals, which means that those patients were under control. And all of them had admitted to NICU for the cardiac surgeries. So I would want to talk about the Niigata Prefecture samples. Niigata Prefecture has a very wide distance, just about the 330 kilometers distance. And among this area, the only Niigata University will cover the whole area. 2 doctor helicopters transport patients to the university within 1 hour throughout the prefectures. So it means that the doctor helicopters will cover about the 300 kilometers. So the short summary of my talks is doctor helicopter will cover approximately 200 to at least 200 to 250 kilometers. Fetal screening is very mandatory, very important, especially for the pregnant woman who is living in a remote island. And it's very important to lower the risk of delivery and link it to the neonatal medical care. So my third talks about this is fetal diagnosis rate of congenital heart disease in our hospitals. As the graph has showed that the prenatal diagnosis of severe congenital heart disease at our institutions. As I mentioned that I started to work at it since 2003. At that time was just only the 50 cases were just diagnosis during the fetals. But right now we have just above the 150 cases, maybe near to 200 cases were diagnosis during the fetals. Looking at the HL test, the blue will show that the postnatal diagnosis, and the red shows the prenatal diagnosis. As you can see here, the patient who are not diagnosed during the fetal was just in only 1 or 2 cases, but majority will be diagnosed during the fetals. So almost all of the 90 percentage, above the 90 percentage, will be diagnosis during the fetal period. As the same as the PFS, among those couple of few years, the 100 percentage were diagnosis during the prenatals. No cases was diagnosis at the postnatal. They're looking at the coactation complex or interruptions of artery. As you can hear, except for 1 or 2 cases, but the others were with diagnosis during the fetal cases. And what would happen? The cases were suffering from the circulatory shock due to the coactation complex or interruptions or arteries, which means that if the PDA closure, spontaneously PDA closure will happen suddenly, it will cause the circulation shock. But I can mention that just only 1 or maybe near to 0, we wouldn't have any cases were suffering from the circulatory shock. So when I started with, about the 2003 or something like this, eventually maybe once or twice I was asked to in an emergency case to screen for the possibility whether the patient would have the PDA dependent severe heart disease, maybe once or twice in 1 month. But this recently 5 years or maybe just around 10 years, it should be very seldom to call for the on-call doctors. So the short summaries of this my talks is 80% of most complicated congenital heart disease are diagnosed during the fetal life. The cardiac shock case were suffering from the PD closure, becoming very rare. My last talk is about the current status of the ambulance services. This is the picture of the ambulance car. The national average time required to arrive at the scene was just about 10 to 10.3 minutes in 2023, which means that if you ring up for the ambulance car, the ambulance will reach to your home uh, uh, for just around maybe 10 minutes or so. The average time from the time for of an ambulance call to arrive at the scene, it was in the area of the Yokohama City was 2013 was 6.8 minutes, but it's becoming prolonged 8.8 minutes in 2023. It means that it's getting but it's required a few minutes or extra few minutes compared to the 2013. So it is well known that the time from the cardiac permanent arrest until life-saving treatment is given, and the life-saving rate, or if the appropriate treatment is given, chest compression within 1 minute, the survival ratio should be around 90, 98, I'm sorry, 95%. And within 3 minutes, the 75% were saved and brain damage may be avoided. But if it requires much longer than 5 minutes, the survival rate will be dropped to 25%, and after the 8 minutes, the chance of survival is very low. So after 10 minutes, the brain functions will not restore. As you know, the bystander CPR is very important to get the survival ratios improved. As you can see, this is the bystander number. This is the without the bystander. This is the bystander. So the time from the cardiac arrest till the erectile shock given by the emergency service, it should be very important. So we will always educate the parents to how to resuscitate if each child has suffered from the cardiac arrest. Please do the chest compressions. Please do the respiratory support, the artificial breathing. But still, what is the fact is that if the patient had uh, for example, if the patient had uh, multiple surgeries, such as the frontal operation or the single ventricle circulations, the patient, even the parents would perform the CPR, but still, almost all the cases could not get survived because I believe if once they asked for the ambulance car to reach for the home, it was required for 10 minutes or so. And also it was required to get reached to our institution. Average should be around maybe 40 minutes or so. So even in these situations, it should be very difficult to get survived once the patient had have a cardiac arrest. For the biventricular repair, it should be okay, but the single ventricle repair, it should be not enough. So we should think about how we could get uh, shorten the time of the when the patient has received the cardiac arrest, and then next for the CPR. So the summary is fetal screening is mandatory. It's very important, especially for the pregnant woman who lives in a remote island. The 80% of most complicated CHD could be diagnosed during the fetal period. To build an efficient emergency transport system is essential to save the life, especially for those patients who had a CHDs. Thank you for attention.
Thank you, Dr. Hideaki Ueda, for your extraordinary presentation. Next, we will enter the discussion session. So, if please, if anyone wants to ask questions, raise your hand or you can write in the chat column. Untuk Bapak Ibu sekalian yang ada di ruang Zoom, kita masuk ke sesi selanjutnya yaitu sesi diskusi. Jadi silakan jika ada yang ingin bertanya bisa langsung raise hand atau bisa menulis di kolom chat.
Thank you so much, Dr. Wedia, for excellent presentation about referral system. I'm interested in fetal echo screening, especially it will improve the neonatal outcome for congenital heart disease. So, what is the strategy do you suggest for Indonesia to increase the fetal echo screening? Thank you.
Thank you very much. I think that's a very important question because, as you know, Dr. Winner have visited to our institutions. Just that was 2018, and she was visited to the Dr. Kawataki's room because at that time the majority of the fetal diagnosis was performed by the Dr. Kawataki, and I had started my career at my hospital at 2003, and I would like to show. This is the 2003, and he has started uh, among the 2001, something like that. He always made appointment to the every private hospital who had a deliveries. And I think there was around maybe about 50 or 50 or maybe just around 70 places or so. He had teach it to the every technicians. The technicians will routinely measure the size of the fetus by checking the circumstances of the head, or maybe the femoral length, or maybe the circumstances of the body stocks. And so they're quite used to use the echoes. And then Dr. Kawataki had uh, trained those technicians for several times. And what we found was he had uh, he had this visited to every institution and every clinic and every uh, city hospitals in all Kanagawa's prefectures. So no one don't how do you say, everybody know about the Dr. Kawataki. So because of his visiting, the ratio of the patient who has screened during the fetal had jumped up, as you can see here, from the 2003 or maybe 2005. The numbers goes arose. So I think that of course there is a limited human resources, such as the OBGY doctors maybe could not get numbers even in our countries. But I think that every technicians could have a good skill if they're trained. I think as you know, we have a many lineup as you have a double, maybe triple. Um, each of the technician may have a chance to learn from these techniques. They were able to screen the uh, maybe the using three vessel view or maybe trachea view or something like that, fortune view. I think they will have a good chance to screen the congenital heart disease. So the as you know the only the good surgeons in the our countries is only maybe 3 or 4 doctors. So we should gather if we want to save this life of those very severe, complicated cases. But still, uh, eh, how do you say? Those numbers of the surgeons is very limited. So we have to centralize it. So we are not planning to centralize in maybe measure maybe 10 centers, but still it's not working properly. But in the beginning of the 1980, there were very limited places who could get survival. For example, no procedures. Only 2 or 3 centers could get survival those procedures. So at that time, from the whole area of the Japan, we was we sent it to those the very good skilled doctors, surgeon doctors, to get survive of the novel procedures. So what is now that happened that the majority of the congenital heart disease were living in the Kanagawa prefectures. About the 80 percentage will be sent during the to our institution during the fetal. So even those numbers, it may cause us to make schedule how we should deliver. For example, emergency C sessions is better, or maybe natural delivery is okay, or if we should perform the emergency cases of the interventions for to save the life of kids, well, when we should perform the uh, next, for example, PAB or bilateral PA banding or BT shunts, we can schedule it before and then tell to the parents. So I think the prenatal diagnosis is very important and also very mandatory to handle those kind of the most very difficult cases.
Oke,
How oh, that's he fall back to me. Right. Oh, you did with that. You feel it. Act your
I'm not working with the teams 10, 10 to 12 persons are working as a congenital team of the pediatric cardiology. So it's not a huge number compared to the other through the hospital, but still, as those because of this fetal screening, we were able to maintain our quality of life. Because if the for the other northern part of the Japan, the fetal screening is not so high as the number of the 80. So uh, among those prefectures, the ductal shock will occur, uh, but not so frequently, but sometimes it will happen. So at that time, the doctor will be requested to do the emergency diagnosis. They'll ring up in the midnight or something like that. So, well, we're very lucky that those prenatal diagnosis will help to improve our life also.
ensure we hope also many obstetricians have become hot skin.
Yeah, I think because of even for the doctor of the OBGYN should be very, how to say, should be very busy because I heard that from the Dr. Wama or Dr. Miko will have 3,000 delivery for each year. We just have only the maximum for 1,000 cases for even for the busiest places. So they or you have 3 times larger. So among those large number of the delivery, the doctor could not be occupied doing the all feature screening themselves. So I think it should be better to ask for the technicians to be involved in these screens.
Yeah, you're right with their obstetrician or gays. Okay. Go under what like uh another topic that the collaboration patient towards in hospital. So Dr. Opik, see you have on TG of outside that she said so these kids choose how is outside that is 100 nurse
400 this are
up yeah 200 it's great. So this is the boss of the
so in my place is there 430 beds, 430 days. And I think the nurse will have, I don't know the exact number, but should be around maybe 600. It's
so the consultant
630.
is perfect for the
So doctors, we have a sort of 100.
doctors 100 at Kanagawa doctors 100 and nurses 600.
6% is the
Children, women and children or only pediatrician? Doc- No, doctor in one hospital. Yeah. But the hospital is women and children. No. Yeah.
No.
Also by household.
Well, not huge. And they're including the comedy power. There's one type that are hospital and purposes. Yeah, didn't know hospital.
Kanagawa is Kanagawa General Hospital like also the is okay it's surgery for
Yeah.
for a lot for the kids only.
Oh, for the kids. Like that, like this hospital. Pets. These are kid and walk mother. Yeah. Actually, they're saying kid. This one kid and mother. Kanagawa was only kid.
How many kids?
My mother and the kids was with fear. Only for the pregnant woman. Only for pregnant woman. Yeah, like you only is a pregnant woman.
So tadi RSAB itu bilang advertisement work all about woman not pregnant woman. You do and rumah sakit anak dan gisawi.
For example, if a mother had breast cancer, we have to deal with it.
But
We can do it.
be like me if woman has lupus erythematosus we have anesthesia a woman but not only for pregnant
Or,
or
uh-huh. So I think we cannot take care of
yeah you only for
other purpose.
the small portion of nurse for 430
430.
women addresses in death for more than that RSM how many deaths 36 out man yeah Actually, already the hospital is general hospital. So have many.
So Yokohama, it's just middle scale because large general hospital will have 700 to 800, maybe just the 1,000 specs.
100.
1,000. Yeah, 7 to 1,000 specs. So our children hospital is just in the middle size. It's not so large.
How many catalog do you have there?
Only 3.
Only 2 books.
Other might be how do you say? I use only for 1 week when we will have 4 to 500 cases for that
Per year.
per per categorization.
Every day, 5
Maximum 4.
or 4.
Monday and 1 or 2, and Wednesday and Friday at 4. But we did not perform during the third Tuesday of this.
So not every day not every day.
No, okay. Yeah. And the interventions we have 150 cases of year. So the other is the diagnosis at the hours. And that's the most problem for us because how do you say it?
About this for interventions. Yeah, hybrid. You do hybrid procedure.
Yeah.
Started working
In the same catalog because it's located in
with you one.
and our catalog is located in the operation ward. So we don't have to we can do
But
it.
if OT over pediatrics or
He just needs
Just-
operation room, catheter rooms, and next this LC.
that company period 1 week.
But still in our catalog is inside the operation ward. So it's the design and also the
IGASM hybrid.
Yeah.
so yes, alright. So we can perform open heart surgery in the catalog. And sometimes we perform, for example, PA Bandung.
Yes, benar to have bandwidth, jadi asal your number successful number of hypoplastic heart syndrome how many? Of first stage? Apa berapa?
The totally 80% will receive the pump operations.
80% tau. So the pretext for the management.
Yeah, here we number said, yeah.
I clearly understand the risk because in the when I started now area when I was just over 30 years, no patient were diagnosed during the fetal period. So afterwards, the diagnosis was done, and they were transferred to the universities. And we just performed bilateral PA or maybe no at age of 70 have takes, and that is 3 weeks. So the most appropriate, the most ideal is just on 2 or 3.
Or 3 days old. Who was performed surgery is start in terms of
If the patient, the saturation will about 90.
So you lost you do not good as soon as possible.
No, just only bilateral feedback.
With then and that
And then
not good
no, they maybe 1 month.
or what man. But at the hospital PD steady. Oh, that PD steady.
Recently, our surgeons hates very he doesn't agree with stent implanters because is not sacrificed with the methods. It depends on each philosophy. Doctor also will allow us to good and but the most recent doctors he use no sacrifice with himself or stay. Yeah. So we just keep the person around. Sorry. So you do better in a week. Yes, for second years until 1 month. And then no. Oh. But if the patient had something wrong, we just perform the lower at the day of the 5 to 7 after this. So it's completely important what the first palliations will be performed for the kids. Get the kids' saturations go above 90%, which means that QPQS is just about 4 or 5. Okay? So that will be volume overall against the album will be happen above 5. And the album contracts will be very, weak. So it is very difficult to get a couple. Once the album contracts will get this minus, there's no chance to get support.
It's very interesting. Because I
So I think if you perform maybe day or 2 or 3 or the better the band at first, and then do the same part the PA sculpting,
accept the
it should be
same day, right?
same day. Because we ask for the surgery to do the open heart, right? Chest opening. And then we do the first to regulate the PAs. We just perform the right PA buzzing and then place a PDA sample. And then the surgeon will do the left PA buzz.
Accept that. But open heart surgery, but dermatology gets dermatology.
Yeah. So there was just be found just next during even the PDA step. We just move.
Here is a side, yes. The subject and then
We also
that's it. So you put what step in the
correct. These 6 or 7 needing to bind the kicks. Run. Because said only no corners. It doesn't work. It doesn't work. So mid side stance. Mid side stance. For the wing, like
yes,
so it's a expanded stance.
it's better.
Or maybe both expanded steps, such as on the boss. 완전 way or only way. Only way is the you know how so you do videos can be first and then PBL or PBL first that like key environment and then PBL set it with this happy.
The same type. The same type. The same type. So
Just really inside or it you in hybrid color. The social sets their local do the body banner and then it was idiots or this standard share bill the home to that back and we just echo to be sure that balance works. It is in lyrics we just ask for EU martial type. This procedure asset così. Nani? Jeff men let's silence inside.
I've had syndrome case in 1 year. And when
Also votes C is 8 to maximum 50.
50
50.
in 1 year.
And but yet the number is getting I think reduced because with taking the prenatal diagnosis,
Yes.
we inform the parents and some of the parents They refuse to defer the treatment. And the most worst thing is the doctors. For example, there is the doctor dermatologist the plastic surgery had online. If the daughter or son was we experienced to doctor plastic surgeries or the dermatologist, they never allow us to go through. The doctor from the private prescribed the hospital or private office.
Yes.
There is a bus.
What?
It was measured maybe about 8%. No.
Inside that. Namishi. Mercy. So,
Now if you was all the subject get procedure. All the subject. All the specialist pediatric cardiac all not special except hormone people or the pediatric cardiac surgeons can no good. Yeah. I only at the time I will know only Swisamu. Tas Wisano serious. Samo. Yeah. Even we invited him at here.
yeah.
Then finally the patient died. Siban on Mormon.
Yeah. Yeah. Kicking the text.
Yeah. Kiban. After that, the bahan back. Nishama. I'm very interested that for these either 3 or 4 years, I annually I have 3 or 4 cases in 3 buggers and in PIBs. That's not 5%. But recently I had no cases because I think the abortion patient is sitting higher. And the brain person that another part of Japan, there are many cases in these many phases of the buckets. But Samba in Kanagawa reports though no disease have disappeared. It's quite
Oh, yeah.
it's like the applications.
Tapi dia pernah ask about the nurse. Said that, yes, the nurse wrote saat dia surgery that have special training for so you have this for
Medical doctor also was head of the cardiac surgeon. He always asked for the special training that's just limited maybe to 80%. But right now, the surgeon tell them just say in front of
I will teach you.
and he always said that I don't rely on this. Or we know how to do it, but still, he doesn't want
But there is not in the OT room like
how to. But they will simply move to the for example, maybe only 1 month they'll move to this skin dermatology operation. 1 month they'll move to the other.
adaptable seriously. There
Yeah. So most of the nurses are not so interested in the behavior as but even for the implications of the lab will attend to our interventions, it's only 1 or 2. The majority is not interested. So whenever the complication will happen, right? And they will not recognize that the devices have dropped in security. Rankers is still that what we should do for the next supper, what we should do for this recap or talking plus different topics. So
And thank so much for everybody who attack this. Paul mau pengen tag at RCF community as. Ada berapa back caranya? Amaraps.
Ya, itu 200 sana. Jadi
So Paul, yeah.
total 1.000 Diki.
General Hospital, the biggest in Indonesia. 800 beds, the biggest in Indonesia. Skip almost 2,000. So, like, kita perlikan yang Buddha theory on awareness, but total dia tidak okay. Sampai can bantu nih. Oh, bagay.
See those related obviously. There are specialists, special amounts for the office hospital to encompass also unlocked see is their philosophy. Always you
You know, you know the way and contact we can cause Zamzani also. But the way I was company makeup service. Then the movie come up issues. And yeah, was telling them that we go to like Tokyo or Badass. So,
oh boy sorry you do don't pass. I think it's
sa tabi, no, Dr. Rina, no, I'm like, they come out for sure.
Was geologiques upwards of meters than the other.
and but there we colors.
DC.
Yes, Stacy. Nearly
Oh, okay. Yeah, because yeah, karena because and that's also topic that we should see what specialize in Kanagawa and she will bring us to Kanagawa. Okay, our director mental health. When they are program, you know, Amal, you know, like that. So, yeah, for me, also for me, I want to go to Yokohama. What is the name of the city? The big eye of its eyes in London.
Lah, si, okay.
Eye and web. What is the game? Yokohama.
it was
No, easy. No,
They die like on the edge of
like London eye, but you have what? Have crown like you can.
Oh,
Wrong. Yeah.
Yeah.
What is the?
yeah, we show in new picture on well,
Okay.
like London, was the Singapore, Singapore fire.
Well, next up, properties. We will go Yokohama.